I'm glad you decided to take a few minutes to learn about how you can get American Board of Family Medicine Performance Improvement Credit and Continuing Medical Education credits for working to decrease health disparities and improve equity within your practice. To maintain board certification, we are required to do 1 or 2 performance improvement projects for each 3-year stage. There are many options available for these practice improvement projects. The Health Disparities, Equity, Self-Directed Clinical PI activity allows you to get 20 ABFM points out of the 50 that you need every 3 years and 20 prescribed AFP CME credits. I want to show you in how as little as an hour you can use this pathway to get the credit you deserve while improving health equity within your practice. You cannot submit your project until it is finished, but you can start it at any point. Your project does not need to be anything complicated. To get credit, you need to assess and work to improve the way that your practice addresses social determinants of health, health equity, and/or systemic ways in which you ensure that patients' access, experience, and care is equal. This performance improvement project can address many different dimensions of care, such as addressing race, ethnicity, socioeconomic status, sexual orientation or gender identity, disability, rural or underserved groups of people. From this, you can plan an intervention to close gaps in care. For example, disparate outcomes of common screening activities, such as cancer screenings, and conditions, such as quality measures for hypertension or diabetes. To get started, go to the ABFM website at www.theabfm.org. Click on Physician Login in the right upper corner. Log in using your ABFM number and password. This will bring you to your physician portfolio. Scroll down to the My Activities section and then click on the Search Activities button. In the search area, type Equity and click on the Search button. Scroll down and click on the Health Disparities, Equity, Self-Directed Clinical PI activity. Click on the Start button to go to the form that allows you to submit your project online. As you can see, there's a progress bar at the top so that you can see how you are doing. The project name is already entered as Health Disparities, Equity, Self-Directed Clinical PI activity. You can change this if you would like. Enter your practice name. Click on the area and then click on Find Organization. Start typing the name of your organization, then select it from the list or click on Create an Organization button at the bottom. Your name, email address, and ABFM number have already been entered for you. Next, select the beginning date of your project and the completion date of your project. The project needs to be at least 7 days, but not more than 12 months. Again, you need to select a completion date that is later than today. If you've not completed your project yet, you can enter your information, then save it and submit it once your project is finished. Select how your project was funded. Select internally if you did not get any funding for this project. Next, you will need to select a topic area for your project. In box 5, you will need to type your description of the problem that you were trying to solve. 1 or 2 sentences is fine. For box 6, enter your aim for your project. Make sure that it is a clear goal, generally including numbers and a specific time frame. This will generally be just 1 sentence. In box 7, you'll be entering the details for your measure. This should come from your goal. You will need to enter a name for the measure you are working to improve, the goal, then your baseline and follow-up data. For box 8, you will type a couple sentences describing the intervention you made, and for box 9, you describe what impact these changes made and what lessons you learned from this project. The rest of the form is to attest that you were involved in the project. You do not need to be the one doing all aspects of the project in order to get credit. At the bottom of the form, you must attest that all questions and fields have been completed fully and truthfully. Each section of the form saves as you complete it, so if you wish to finish it later, you can close it out at any point. When you are finished, click the Submit button. If you need more assistance on performance improvement projects for your board certification, the ABFM offers support through their website or by phone. The Ohio Academy of Family Physicians offers additional support for maintenance of certification and ABFM performance improvement at ohioafp.org/easypi.